Hi there, welcome in. My name is Dr. Mint and I'm going to be taking care of you today. How are you doing? Good. So I saw on your chart that we are going to do a pelvic exam today. Is that correct? Okay. Yeah, so just so you know, it is a new policy to get written consent for sensitive or intimate procedures such as like a pelvic exam. So what we're going to do is get your written consent. So I'll just have you sign, initial, and date this form if you are comfortable doing that today, okay? And it's basically just going to be a visual and manual examination of your pelvic area. So we are going to be looking at your scrotum and your penis. And we're going to observe for any like lumps, bumps, redness, abrasions, discharge, things of that shouldn't be going on down there. Are you comfortable with that? Okay, so I'm going to give you this and then you will just sign and date. And also keep in mind that you are totally in charge of this appointment, and if at any point you ever feel uncomfortable or need to stop, then we totally can. By signing this doesn't force you into like completing the procedure whatsoever. Okay, thank you. And other things to note, there will be a medical chaperone in here as well, observing, and you also reserve the right to request a male doctor if you would like. Yeah, and again, if you ever change your mind, want to switch it up, get a male doctor, you can let me know and we can stop the examination and change. Okay? Perfect. So before we get into all that, we're just going to do the normal checking your vitals, all that good stuff. So you can just sit back, relax. First, we are going to do your blood pressure. So I'm going to put this blood pressure cuff on you, okay? I'll just give you your arm. Good, there you go. Okay, and can you just uncross your legs for me? All right, and I'm just going to start the machine, and we'll just sit there and you can just close your eyes and take a few deep breaths if you'd like. Okay, let me get that off of you. Perfect, and blood pressure is looking good. I want to take a quick look at your eyes. So I'm just gonna have you focus here on my nose, okay? Just keep your eyes still. I'm just gonna shine the light into your vision, check your pupil reactions. Good, good, good. And when is the last time you had your eyes checked? Okay, so coming up on needing to get an eye test. All right, and now I want you to follow the light with just your eyes, so keep your head still for me. Good job. Good job. Good. 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 And watch it as it comes closer. Good. And back away. Good. As it comes closer. Good. And back. Perfect. Let me see. Where is this? I'm going to take a look inside your mouth. Can you just open your mouth wide for me? Say, ah. I'm going to try to take a better look at your tonsils. So I'm going to put this on your tongue there. There you go. Good, everything is looking all right. Now I'm going to listen to your heart. So I'm going to put on my stethoscope. Warm it up a little bit and then, okay. I'm just going to listen to your heart so you can just sit still for me. Good, sounds strong and healthy. Now I'm going to listen to your breathing. Just breathe normally at first. And some deep breaths. Again. Good job. Okay, switching to the other side. And breathe normally. Good. And now deep breaths. Okay. Have you been having a little bit of a cold right now? Okay, yeah, I noticed a little bit of wheezing. Do you generally get like a little lung irritation or like asthma? Okay, so you've had a history of asthma since you were younger. Okay, let me just mark that down in your chart real quick. Do you use an inhaler or a rescue inhaler? Okay, so you haven't used an inhaler in a while. Okay, so would you guess that inhaler that you had is expired? Okay, so what I'm going to do is I'm going to write you a prescription for a new one, just in case, because I did hear a little bit of wheezing while you're breathing. I'm sure you felt it a little bit on the really deep inhales. Yeah, okay. So sometimes it can just come back with illness. You know, it could just be related to the illness, or maybe you're having a flare-up of your asthma again. Sometimes in some patients we see that it kind of ebbs and flows for some people. Yeah, I had it once when I was, I got really sick when I was about middle school, and yeah, I had to get an inhaler for that. So it can totally just happen and flare up for certain reasons. I know right now the pollen count is super bad, so if it's allergy related, then that could be it as well. Okay, so I'll get you an inhaler prescription. And in your chart, it doesn't look like you're allergic to anything, correct? Okay, good. Just double check that and do you stain on that? Good. Before we move into the examination portion, I'm going to ask you a few questions just to get a better gauge of your health and any risk factors that you may participate in. Pardon my stomach, oh my goodness. Almost lunchtime. So, to begin, in the last year, how many sexual partners have you had? Okay. And now with these partners, are they male, female? Prefer not to answer. Okay. And during these encounters, are you using contraceptions, like a normal condom, a female condom? Okay. And would you say that you use them every time, or? Okay, and this person, were they like a long-term partner, or was it a new partner? Okay. And had you both been tested for any STIs? All right, and when was the date, if you remember, of your last STI test? Okay, that's pretty recent. And I don't see the results of that in this file that we have. Which hospital or clinic did you go to? Okay, so we will request those records. If you don't mind me asking, did the results come back all clear? Okay. Good. Okay, and then to follow up, have you partaken in any drugs, any intravenous drugs? So like using needles, sharing needles with anyone? Okay. Yeah, I know these can be a little bit of uncomfortable questions, but it just gives me a better idea, like I said, of your risk factors. Participating in exchanges of bodily fluids is where your risk factor is going to go up. Obviously, if you're sharing needles, having unprotected sex, things of that nature can really increase your risks of things like HIV, for example. Okay, so again, you don't have to answer if anything makes you uncomfortable, but this is a safe space, and none of your health information goes out to anyone else. It's only on a need-to-know basis, okay? So, there we go. Perfect. Have you had any tattoos recently? You know, any tattoos from any places that seemed like they weren't very sanitary, things like that? Okay. Yeah, again, just have to check. Any recent piercings? Okay, and those were from like a reputable establishment? Good, good, good. Yeah. There's always that trend of people piercing their own ears, etc., and then not sterilizing needles properly, things like that, which can cause infections. And again, it's always best to catch things like that quickly. Amazing. Okay, and are you on any medication currently? Okay. And how often are you taking that? All right, I think that's all the questions I have for now. Are you still comfortable doing the examination today? Okay, so we'll do just a brief little synopsis of what's going to happen. So I will exit the room and you will undress into the gown, and you can just take a seat back up on there. And then I will come back in, and as well as the chaperone, and I will perform the examination. So obviously I'll be wearing gloves, and we'll do a little palpating on your lower abdomen area, which just means like some kind of firm taps, and I'm just feeling for any painful areas that you may have, or any spots of firmness that shouldn't be there. It's going to kind of give me an idea of your anatomy when I'm tapping. And we're going to check for hernias. And then I'm just going to do a visual examination of your genitalia just to make sure that everything, again, there's no lumps, bumps, redness, irritation, scrapes, anything of the sort. And that'll be it. And then we'll just get in and out of here as quick as possible. All right, sound good? Okay, I will step out and I'll be back in a few minutes and we'll get going. All right, I am back, and the chaperone is going to stay over there. They are here just to observe for both of our safety, okay? And they are a medical student, so they are, medical personnel. All right, and you're comfortable with them being over there? You're fine? Okay, good. So I'm gonna get ready for the examination. First, I'm going to apply some hand sanitizer. It's also important for you to know that you can do this kind of checkup yourself too. It's important to do self-checks of your genitals just in case, to know your body, in case there are any changes. Sanitizer always makes getting gloves on a little bit harder. My hands are so dry. Yeah, the struggles of having to use hand sanitizer all the time. My skin just gross. Okay, so we're gonna begin with the palpation. So I'm going to move your gown aside, and I'm going to start on your lower abdomen. I'm going to be palpating that area, and just let me know if anything feels uncomfortable, okay? And I'm not going to be pressing too hard, so there shouldn't be, but do let me know if you do feel any pain, because that could be a sign of something going on, okay? So let's begin. So, palpating lower abdomen. Any pain there or discomfort? No? Good. Good. Good job. Good job. Now we're going to move on to the visual examination of your genitalia. So I'm going to use my light and just shine it on your penis and scrotum. And I will, in a moment, ask you to raise your penis out of the way so I could just get a better look at the scrotum. Okay, so far everything's looking good. No signs of redness, irritation. Now can you move your penis out of the way for me? Thank you. Okay, good. And you haven't noticed any discomfort in any of these areas? Any discharge? There hasn't been any recent injuries? No sports injuries, anything like that? Okay, and do you partake in like sports? Okay, and you make sure to wear an appropriately fitted cup? Okay, good. Yeah, no, it's very important to make sure that your fit of your protective gear is the appropriate size. All right, everything looks good. So again, now I'm going to begin by palpating your penis, okay? And just so we know, it's totally normal for an erection to happen. Obviously, we're touching an organ that responds to touch, so it is completely fine and common for that to happen. If you ever need to stop, then we can, but I'm going to be as quick as possible and we'll just get this done and over with. All right, so let's begin again, just lightly palpating. Good job. No pain anywhere or discomfort? Okay. And again. Good. Okay. And then as I look down your urethra, no signs of any discharge. Okay. Now, again, I'll just have you kind of get your penis off to the side, and I'm going to take a look at your scrotum and make sure that each testicle is of appropriate size and not having any areas of overly firmness or bumps. Okay, that's good. And the other side. Okay, good. And now I'm going to check for hernias. Let me just get my hand in place. And now if you could turn your head and cough for me. Thank you. And one more time. Good. Okay, back to this side. And again, just turn your head away from me and cough. Thank you. And one last time. Thank you. Thank you. Okay, that is going to be it. I'll get these gloves off. And do you have any questions for me? No? Well, perfect. You are all free to go. We will step out so you can get dressed. And when you speak to the gals up front, they will get you that prescription for the inhaler. Everything was looking really good, and we will see you back here for your next checkup. Bye-bye.